One of it that affect directly to us, to Director of Medical Services, is the neonatal mortality and also maternal mortality. Neonatal mortality, you find that we are slightly below the average, but we must take it to account that for a child outcome, or a mother who is pregnant outcome to be good, it starts from the day of conception. Is it planned? And what are we doing about this? We are doing what we call capacity building and also performance appraisal and performance contract reward to our CHPs, so that they can catch or get women who are pregnant first in time, so that we are not talking about the 4 antenatal visits, but now we want it to go to 8 antenatal visits, which is recommended by WHO.
Currently, we are disseminating the report of 2022 Kenya Demographic and Health Survey. Some of the indicators we have done well, others we have not done so well.
The main cause is pneumonia, which is a communicable disease, and we are working so hard to increase the vaccination coverage, which we are also performing a little bit below the average, so that we can reduce, because the only way to reduce the communicable diseases is to increase on your immunization, so that those who don't get the immunization may have the advantages of herd immunity.